Bill making its way through the Tennessee General Assembly would treat people with natural COVID immunity the same as people who are vaccinated. House Bill 1871 would prevent the government from enforcing COVID restrictions that treat people who have had the virus differently from vaccinated people. Liam Collins is following this. Liam, what is natural immunity first?
Yeah, that's the protection, Cindy, you get after you've already had the virus. Representatives advanced the bill out of committee earlier today. Supporters cited reports saying natural immunity gave the same protection as the vaccine, but doctors and health officials today told me while that may be true in some cases, that's not always the truth. While the numbers of cases are falling from the Omicron wave across Tennessee, legislators in Nashville are moving forward to change the game post-pandemic.
All those in favor.
House Bill 1871 passed in committee Tuesday. The bill would require unvaccinated people with immunity to be treated the same as vaccinated people. The state would have to allow people who prove they had the virus to be included in any potential vaccine requirements.
I don't think anybody in a lab can design an immune system that is superior to the one the creator of this universe designed.
I'm not going to go against all the studies that have said just the opposite of what you're saying.
The bill's sponsor, Republican Representative Bud Halsey of Kingsport, backed up his bill, saying the immune response in the two groups was nearly identical. The CDC says people with vaccinated immunity and natural immunity both develop substantial amounts of antibodies for up to 6 months, but the immunity from the vaccine lasted up to 50% longer than natural immunity.
You don't know if you're going to be one of the 90% that does well, if you're going to be one of the 10% that gets really sick, or one of the, depending on the variant and the time, 1% who may die from the disease.
Dr. Carlos Balaero says natural immunity from the Omicron variant did provide better protection than vaccines alone, but the combination of an Omicron infection plus a vaccine gave patients up to 13% better protection from reinfection. But he says that so-called natural immunity will likely not last if the pandemic stirs up another COVID variant.
Because again, so many people had disease in the alpha beta waves, and then the same people got sick again with Omicron.
Now, the bill was referred to the House Calendar and Rules Committee. It will have to get past that before getting a full floor vote. Today, Pfizer also submitted an application for an emergency use authorization for a second booster shot of its COVID-19 vaccine that would only apply to adults 65 and older for right now. The company based its data off of research from Israel, where the fourth dose is already offered to adults 60 and older. Cindy.